Hi everybody. Oh, welcome back to my channel. It's Amin here and I am back with another vlog as a week in my life as a genetic counselor. It has been a long time since I've done a video like this and I have a lot of things to update you guys on in terms of what's been going on with my job and my role. And it is Monday currently. I'm just about to start a meeting and then I have a couple of patients and then another meeting this afternoon. And like I said, I have a few updates to give you guys, which I'll give you throughout the week. We'll talk about all the cases that I'm seeing and the different specialties that I'm seeing because I now do more specialties than I ever have before. I also started a part-time job, so there's a lot to catch up on. We will get through it all. So excited to be filming this video and having you guys come along with me for this week. Looks like I haven't done anything, but it's actually lunchtime now, and usually I would go and eat lunch with my colleagues, but I have a really busy day, so I'm gonna eat lunch at my desk. I'm gonna watch some YouTube, so I'm not actually like working through my lunch, but anyways, so I had two appointments this morning. So I had my meeting at 9 o'clock. Then at 10:30, I had an appointment for a patient that has a child with a de novo genetic condition that causes epilepsy. So it's a genetic reason that was not inherited that causes epilepsy. They're pregnant again. So we were talking about the recurrence risk, which is quite low, like less than 1%, but then the testing options that they have available. And then I just had, right after that appointment, I had another appointment to review abnormal results from an amniocentesis procedure. It was a microdeletion that was found. So we met with them, reviewed the report, and then they are going to let me know how they want to proceed. I kind of want to take the rest of the day to make a decision, which is fair. And then I have a bit of a lunch break. I am doing a triage today. So for our prenatal team, we actually divvy up and triage our own cases. We do it every day. So Mondays are my day. So we go through the referrals that are incoming and then organize which referrals went to which GC, and then also if they are GC only or if they're GC plus a geneticist. And usually the geneticist ones are if there are like ultrasound abnormalities or the person themselves, like who's pregnant, also like potentially has a genetic condition. And then we have some high risk referrals, which are like NIPT positive referrals, or like, yeah, mostly it's like NIPT or NIPS, whatever you want to call it, high risk or positive referrals, or like ultrasound anomalies that are very suggestive of like a genetic abnormality or aneuploidy, really. So those conditions are considered high risk. So I started doing that, but I haven't finished it yet. So probably gonna finish that over my lunch. And then I also have a 1 p.m. appointment, which is a family history of cystic fibrosis. And then I have a meeting right after that. So I'll catch you guys in a bit after I'm done eating. Busy day, and tomorrow is also very, very busy. So a week is probably just gonna be really busy. It's good that I'm vlogging this week because you'll get to see a lot of what I do. Just doing a quick check-in. It is Tuesday. I was exhausted by the end of the day yesterday. I did not do another check-in. Basically, I met a pregnant person who was a family history of cystic fibrosis, and they had never had carrier testing done. So we talked about what the condition is, the chance for them to be a carrier based on the family history, and testing that we could offer them. They did not have a familial report, so we actually don't know what variation is running in the family. So we do have limitations in terms of the tests that we can offer. That was that one. And then I had a meeting at 2 o'clock, which is the cancer team weekly meeting. And honestly, because I'm doing both cancer and prenatal, I can't really focus a lot on the cancer stuff because the prenatal stuff is like really urgent. And there were a few urgent things that came up yesterday as well. And then that's pretty much it. That took my entire rest of my day. And today is Tuesday. It's like 10:38. I have a patient at 10:45. I just finished with the patient today. It's been a really, really busy week. This morning I met with someone who on their anatomy ultrasound had pericardial effusion, which is a fluid around the fetal heart, and also bilateral choroid plexus cysts, which are cysts in the brain, which are not super concerning on their own. But met with them alongside a geneticist because there were ultrasound anomalies. This is one of the cases that we do, the GC plus, the geneticist. So I just finished that one, and we have a student. So we have a first year genetic counseling student, and it's their last week with us. So it's actually their last day with us. And my next case is actually with the student. So it's an NIPT positive for Down syndrome or high risk of Down syndrome in the pregnancy. And the student's going to do most of it. I will be there for support and also supervision, of course. And then this afternoon, I have another case, which is somebody who started out the pregnancy with quadruplets. Is that what you call it? When there's 4 babies? I think. There were 4 sacs, but then 2 of them did not grow. So now there's twins left. So that limits their options for genetic screening. So let's talk about the different options that are available to them. And then we have our final evaluation for the students. It's their last day, so we kind of like go through what their goals were and how they're progressing and all of that. And that's pretty much a summary of the day. It's pretty good. I think I've done probably about 20 cases so far. So I feel like it's pretty straightforward. I've only gotten back 2 results. So I got 1 VUS and 1 negative result so far. But otherwise, in terms of the content, like it seems pretty straightforward. Good morning, everybody. We are on Wednesday. I work from home 3 days a week. So Wednesday, Thursday, Friday, I will be at home. And I just finished up a meeting because I'm onboarding to do more cancer cases. So I mentioned this briefly in a previous video, but I'll go into it a little bit more now. I just like look terrible. I'm just not a morning person. But anyways, as you guys know, I started out with prenatal, which is where my heart lies. But I do work in a clinic where we see all different kinds of specialties, and the needs of the clinic have changed a bit to where I need to shift my specialty in the coming months. So this is my last week of doing prenatal, and it is very bittersweet, but I know it's not long term. It's just like in the meantime. So going forward, I will be doing general cases, so working with the geneticist, which is interesting. I have never done that before. And then over the last few months, I have started seeing some cancer cases, and mostly they are family or personal history of breast and ovarian cancer. So hereditary breast and ovarian cancer syndrome testing and screening for eligibility of screening programs, high-risk screening programs. But now I'm going to be transitioning to being like half of cancer and then half of general. So this morning I was just learning a little bit more about what the GI cancer testing and referral landscape kind of looks like, because I'm going to be adding that in on top of the breast. So things like Lynch syndrome, polyposis syndromes, etc. So that starts next week. And I also have my general cases starting next week. So it's a bit of a frenzy this week because we've been really, really busy with prenatal referrals, like probably one of the highest referral numbers we've seen. So all of that obviously is super urgent, and then having to try to get set up for next week where I'm going to be rolling off of prenatal and then onto 2 new specialties. And this is all new stuff that I have not done since I was in school, but I do feel like I have the resources to be able to do it, which is one of the great things about being a genetic counselor, is that you are trained in everything, and then you can kind of shift gears quickly because you have like the foundations that you need. So anyways, that's what I did this morning. I only have 1 patient today. I should have more, but I think we just had a difficult time like contacting some of these patients because again, it's been a very busy week. But I'm going to take advantage of a bit of a break that I have this morning and try to get myself organized, because it has been such a whirlwind that I feel like a little bit like overwhelmed with all the things that I have to do for each patient. I haven't been able to like really like organize and document and like schedule things in and just figure out what needs to be done. So I'm gonna do that, and then I have a patient at 10:30, I think 10:45. What is it? Oh shoot, I need to do some prep for this one. It's somebody that has a diagnosis of neurofibromatosis. So I'm gonna have to review that with the doctor, just because It's something that I've never really counseled on before. I do like know that the counseling is going to be about like the chance of passing it down. But I just want to make sure there's nothing in terms of like their own care for someone who is pregnant and carrying a pregnancy that has this condition. So I just want to double check on that. And that's pretty much it for today. I'm going to try to fill out my schedule today and tomorrow if I'm able to, because again, I roll off of prenatal next week. So I know you submitted the family history questionnaire, so you gave us information about the cancer in your family. So what we'll do for today is I will review that information, make sure it's all up to date, and then we can talk a little bit more about what screening looks like or what screening is recommended for you based on your family's history and your personal information as well, and if there is option for genetic testing. Okay, and then the other thing that we look at is the chance for you to have cancer throughout your life. So that's where we use the information about yourself, like your like menopause and how old you were when you had children and all of that information, plus the family's information. Exactly. Higher than the average, but not in that high risk category. So what we would suggest is to continue your routine mammograms as you have with your doctor. And if anything changes, like in your own family or with your own health, then you can let us know and we can reassess the numbers. Hi everybody, it is Friday. I forgot to vlog yesterday because honestly it's been a crazy week, as you know, and today's Friday and today's my cancer day, and I haven't talked about my cancer cases on the channel before. I've been doing cancer for about 5 months now, and mostly I do family history, breast, ovarian, prostate, pancreas, but as I mentioned earlier, I will start doing some more GI family history, so a colon and uterine, so more like Lynch type or polyposis type conditions. So I wanted to tell you about the cases that I saw yesterday and I guess today. As always, I will never include any identifying information in the vlogs or really any specific details about the indication or even the outcome. It'll be very, very loose, just so you kind of know, get a sense of like what I kind of see, which is pretty much anything. So just looking at the schedule, I think I talked about the person that had neurofibromatosis. I talked about that one, and then had a case that was an FTS positive, so a positive screening result, and that individual was over the age of 40, so advanced maternal age, and their first NIPT was a no call, so inconclusive. So we're gonna wait for the second NIPT result before deciding about something like an amniocentesis. And then after that, I had a case that was a query alpha thalassemia trait for patient and partner. So alpha thalassemia itself is a very common hemoglobinopathy, and a lot of people don't know that they're carriers of this condition, even though it can be picked up on routine blood work. So obviously it's more concerning when both patient and partner are carriers of the same thing. We don't know for sure if they are, so we're doing a DNA test for the gene alpha globin to find out if they're actually carriers and what the risks are for the pregnancy. So that was that case. And then I have cancers on Fridays. So I just talked to somebody who has a family history of breast cancer, so siblings and a parent with breast cancer. So what we do is we assess their personal risk of developing cancer throughout their life to see if they're eligible for high risk screening. So it's a little bit different depending on where you work. Like when I was in the States, we use different criteria. Now that I'm practicing in Ontario, we use a provincial guidelines. So everybody in the province is essentially doing the same thing. And then I'm sure in other places across the country, it would be different. So we use the information about their family and their personal health and, you know, other risk factors they might have to determine if they're eligible for that screening program, which is a MRI and a mammogram. And then we also determine if they're eligible for genetic testing to see if there's an inherited or a genetic basis for the family's cancers. So this individual did not qualify for either of them. So basically just to have routine screening for now. And the reason they didn't qualify is because there are individuals in their family that have cancer have actually already tested negative for the panels that we offer, and everybody in the province gets the same panels as well, which is great. So great that everybody gets the same thing, not great obviously that they had cancer. So it's a pretty like different type of case. It's very straightforward, very routine. A lot of the information I have beforehand. We have all the family history in advance. We've run the risk models in advance. And basically what I'm doing is just updating the information, making sure that it's accurate, which honestly, a lot of the time it's not accurate. There's always like errors or updates from when they do the questionnaire about their family versus when I talk to them. And sometimes maybe things get lost in translation, but anyways, there's always things to update, and then running like the models and stuff and telling them if they're eligible or not. And then that's it. This afternoon I have one more case, which is a prenatal, and it's my last day of being a prenatal GC for just a little while. It's not permanent by any means. And then I know that prenatal will definitely still be seeping into my life after when I start general and cancer next week. Let me know if you guys want me to vlog what it looks like to be a general genetic counselor, like in adult pediatric general cases. And I know prenatal will still, of course, be present in there because I still have results and stuff that I'm expecting in the next few weeks that I will still be responsible for like following up with patients about. But that's pretty much my check-in for today. I will check in one more time at the end of the day, and then the week is done and it's time for the weekend. It's the end of the day. It's 4:08 p.m. I'm just waiting for some amniocentesis results to come out. I'm expecting an abnormal result, so positive for Down syndrome, but this family has told me they're going to continue the pregnancy. Either way, we still need to call the result and meet with them next week to kind of make a plan for the pregnancy and delivery and all of that. So I am hoping it'll be out soon because then I can log off for the weekend. And I kind of want to end the vlog here too because there's not much that I'm going to be doing other than waiting for this result. This vlog is a little bit different than some of the other things that I've posted before because again, I used to do prenatal preconception like all the time. It's a little bit different now and it will actually continue to be a little bit different. So I hope you guys enjoyed this. If you want to see more stuff, please let me know. If you want to see more like specialized stuff as well, like maybe a Q&A about prenatal stuff or a Q&A about like general genetics, cancer genetics. I've always wanted to do like informational interview style video with other GCs in many different specialties, and every year I tell myself I'm going to do it, but I just haven't had the opportunity to do that yet. But honestly, now I'm thinking about it, I actually do a lot of the specialties, so I can answer a lot of the questions. I'm not as experienced yet, but I will be in a few months. So let me know if you guys have any questions, if you have any ideas for future videos, and that's pretty much it. I hope you guys enjoyed. If you're interested in genetic counseling content, I have a huge playlist with so much stuff from over the years, from when I was a student doing my master's to when I graduated, got my job, started working, wrote the board exam, all of that. So definitely check that out. Thank you so much for watching, and I will see you in the next one. Bye.